Hello, please subscribe and like for our channel. Thanks very much.
Hello, now we are going to continue with the next case, which is a 70-year-old man has been sent to the emergency department from a nursing home complaining of intermittent sharp abdominal pain. He has not opened his bowel for 5 days. He suffered a major stroke in the past and require constant nursing care. He has a history of chronic constipation. Previous medical history include chronic obstructive airway disease from which he is on regular inhalers. He is allergic to penicillin and is an ex-smoker. His blood pressure is that, pulse is that, his temperature is that. There is gross abdominal distension on physical examination. There is tenderness, most marked on the left hand side. The abdomen is resonant on percussion. Rectum reveals empty rectum. Is it clear? There is symptomatic soft systolic murmur and mild scattered chest. What does the abdominal X-ray show? So the abdominal X-ray show what is called a coffee bean appearance. Is it clear? So we have a coffee bean appearance. Is it clear? And so that is what you see on the abdominal X-ray. What other radiological investigation is employed if the diagnosis is in doubt? Is it clear? So the first thing is you have to do a abdominal X-ray. The abdominal X-ray is going to show you what? A coffee bean appearance. Is it clear? Now another radiological investigation to if the diagnosis is still in doubt, you can now do what? A barium enema, and X-ray. Is it clear? You do a barium enema and X-ray. Is it clear? Or you do even a barium meal and X-ray, but it's preferable to do a barium enema because it's a lower gastrointestinal tract obstruction. Is it clear? So you do a barium enema and X-ray. Is it clear? Now the next thing is how should the patient be managed? How should the patient be managed? The patient should be managed. So in this case, your diagnosis, every time you see a coffee bean appearance, the diagnosis is a volvolus. And in this case, you have a patient that is 70 years old. Generally, patients that have 70 years old or old age patient, their volvolus is going to be located at the sigmoid rectum. So it's a sigmoidal volvolus. And this is why the pain of this patient is located at the left iliac fossa, because that's the position of the sigmoid rectum. Is it clear? So that's why you have left iliac fossa pain. And now this patient also have percussion that is tympanic at the left iliac fossa, because when there is volvolus, there is going to be accumulation of air in the sigmoid rectum. That's why it's going to produce a tympanic sound. Are you understanding? So those are the different things. So every time you have a volvolus, what is the volvolus? Volvolus is defined as the twisting of the gastrointestinal tract along its mesentery. Is it clear? That is the definition of volvolus. Twisting of the gastrointestinal tract along its mesentery. So how should the patient be managed if the diagnosis is in doubt? You have to do the twisting. It has been twisted. You have to retwist it, to detwist it or derotate. So that's why the principle of management, every time that you have this or this torsion, it's also similar to a testicular torsion. Are you getting? So that's why the management of testicular torsion is derotation. You have to derotate it either manually or surgically. Is it clear? Similarly, for a volvolus, since you are treated, you have to do a derotation. The derotation can either be done manually or surgically. Is it clear? Manually, you can do the derotation with you insert an anal catheter to try to derotate the rectum. Insert an anal catheter to try to derotate the rectum, or you can do it surgically with surgical derotation of the rectum. So that's how the patient should be managed. The management is emergency derotation of the sigmoid rectum, either by manually or surgically. Is it clear? Because if you don't derotate the rectum within the next 4 to 6 hours, there's going to be infarction and it's going to be the necrosis of the rectal cells. and the patient is going to have complete loss. And now the management, when there is the necrosis of the rectal cells, you have now to do a secondary anastomosis by primarily doing a Halfman procedure, where you are going to do a deviation of the rectal physis. Is it clear? So those are the different things that you have to understand. Now the next thing is, what is the explanation for the pathology? Is it clear? Generally, the explanation of pathology of sigmoidal rectum is in this case, you have a 70-year-old man, so you have old age patient. Is he presenting to a nursing complaint of intermittent sharp abdominal pain? He has not opened a bowel for 5 days and suffered a major stroke in the past and require constant nursing care. So another reason for this can be a stroke. Is it clear? Because you need to know that what a stroke results to a prolonged decubitus, and now you need to know that what you need to know that a volvolus occur in patients that have reduced bowel emptying. So people that don't empty their bowel that usually, they can have volvolus. When you have reduced bowel emptying, it can result to volvolus. So in this case, a patient has stroke. So since he has a stroke, he is bedridden. Is it clear? And since he's bedridden, another complication of bedridden is what? Long-term bedridden complication is what? Is constipation with fecalomas. Is it clear? And now when he has constipation with fecalomas, there is reduced emptying of the bowels, and then he has sigmoid volvolus. That's the reason why he has the volvolus. Are you understanding? So those are the different things you have to understand. So we move now to the next question.
Hello, purchase your book, medical book, health science book, physics book, computer science book, all from us on 652-659429, and please don't forget to like and subscribe for our 2 channels, Science Video Makers and SchrDbb. Let me say the number again: 65699429. That is a place where you're going to have all these books. As you can see, we have the computer science book, which is shown in this image. You can see this is all the example of the computer science book, all inside. You have all this. We have the medical book for the first year, second year, third year, all available with all the explanation and questions. We have the physical examination book with all the step-by-step physical examination. This is the workbook for medical third year. The workbook for medical third year. This is the first year workbook. This is the second year workbook. As you can see, this is the second year textbook. All this we have on the no contact 652-659429. Thanks very much.